Welcome to Shri Ram Medical College. Today we will explore terminology used in the operating room by physicians and other medical professionals. Lesson 01. Amnesia, loss of memory of something that happened. General anesthesia, controlled sleep in which you don't feel anything. Local anesthesia numbs only a small part of your body, so you can stay awake. Anaesthesia Associate, a medical worker who is part of the anesthesia team and works under the direction of a consultant anesthetist. Before, it was called physician's assistant. Anaesthetist, a trained doctor who knows how to give anesthesia. Analgesia, pain alleviation. Anaphylaxis, an extreme reaction to a medication or substance. Anticoagulant, medications that stop your blood from clotting. Antiemetic, a medicine that can help stop or treat sickness. Anti-inflammatory drug, a drug that stops or lessens pain and swelling. Arterial line, a needle placed in an artery, often at your wrist. This keeps checking your blood pressure all the time. Your anesthesiologist can also use it to take blood samples to measure how much oxygen is in your blood. Artery, a blood vessel that carries oxygenated blood from the heart to another part of the body. Awareness, getting awake during a general anesthetic by accident and being able to remember some of this time. This doesn't happen very often. Blood clots, blood can clot in your veins, which usually happens when you can't move around as much. This is also called a deep vein thrombosis if it happens in your legs, DVT. If a piece of the clot breaks off and goes to your lungs, this is called a pulmonary embolus, PE, and it can kill you. Blood group, what kind of blood your body has. The main types are A, B, and O. If you get a blood transfusion, you need the right type of blood so you don't have a bad reaction. Blood pressure, how hard your blood is pushing on your arteries. Most of the time, it's written as two numbers, like 120/80. Your systolic blood pressure is the number at the top. This is based on how hard your heart beats, pumps. Your diastolic blood pressure is the number that is lower. When your heart slows down, this is the pressure. Body mass index, a common way to figure out how much you weigh based on your height. To figure this out, divide your weight, in kilograms, by your height, in meters squared. The number should be between 19 and 25, which means that your weight is about right. Over 30 means you are obese. Brachial plexus block, also can be called supraclavicular block or interscalene block, a nerve block can make your arm and shoulder numb all over or just in one spot. This can be used instead of or along with a general anesthetic to numb your arm or shoulder after surgery and make it less painful. Most often, ultrasound is used to guide the procedure. Cannula, a thin tube made of plastic that is put into a blood vessel. Cardiac arrhythmia, a group of conditions in which your heart beats too fast, too slow, or in an irregular pattern. Cardiopulmonary bypass, CPB, a method in which your heart and lungs are temporarily taken over by machines while you have surgery, usually on your heart. It sends oxygenated blood through your body. People often call the CPB pump a heart-lung machine. Complications, there may be problems after your surgery, treatment, or illness. Compression boots, a soft boot that inflates and deflates around your legs during an operation to keep blood moving through your veins. This keeps blood from getting stuck together. Consent form, a form that your doctor will ask you to sign after explaining all the benefits and risks of an operation or procedure. This shows that you want to move forward. Cornea, the thin layer on the front of your eye. CPX testing, cardiopulmonary exercise testing, a way to see how well your heart and lungs work at rest and when you work out. CPR, cardiopulmonary resuscitation, a way to keep your breathing and circulation going if you ever stop breathing, called respiratory arrest, or if your heart stops, called cardiac arrest. Combined spinal and epidural, CSE, a type of local anesthetic that is put in your back and uses both a spinal injection and an epidural injection. This gives your anesthesiologist the option of using the spinal injection to numb the nerves in your lower body quickly, or the epidural if the surgery is likely to take longer. If needed, the epidural part can also help with pain relief after the birth. Cross-match, a test that is done before a blood transfusion to make sure you get the right type of blood. This check means that there is a very small chance that you will have a bad reaction to the blood. CVP line, central venous pressure line, central line, a soft tube that your anesthesiologist puts into a vein, often in your neck, and connects to the large vein that carries blood to your heart. It is used to measure the pressure in your veins and to give you medicine, fluids, or food. Day case, a surgery that will likely make you well enough to leave the hospital the same day. Deep vein thrombosis, DVT, a clot that forms in a deep vein in your leg or stomach. Defibrillator, a machine that uses an electric current to stop your heart from beating in a way that could hurt you. Diabetes, a disease that makes your blood have too much sugar, glucose. Most of the time, a hormone called insulin controls this, but if you have diabetes, you might not have enough insulin. Drip, fluids put into a vein. Different minerals or drugs can be added to these. Dural puncture, dural tap. When an anesthesiologist puts in an epidural, this can sometimes happen. Accidentally, the epidural needle goes through the dura, which is a membrane that covers your spinal cord. This causes cerebrospinal fluid to leak, which usually leads to a headache. Dural puncture headache, a problem that can arise from a dural puncture. Because the needle made a small hole, cerebrospinal fluid is leaking out and causing the headache. It is a rare side effect of spinal anesthesia, a lumbar puncture, or an epidural. Electrocardiogram, a record of the electrical activity your heart makes when it beats. Join Shri Medical College's Bachelor of Vocation in Operation Theatre Technology and take the first step toward a successful career in operation technologist. We are here to assist you in launching your career as an operation technologist. Call us at 9968193009 for more information about our program or to submit an application right away. ShriRam Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel ShriRam Medical College. Good luck, goodbye.